The field of electrolysis is changing. Old methods and instruments are being replaced, and electrologists everywhere are pursuing higher levels of professionalism. You and your customers also face growing concerns about the spread of blood-borne diseases. Ballet created this program to help you understand some of the recent developments in electrology. This program will show you ways to protect you and your client's safety, how to choose the best needle for your clients, and we'll look inside a human hair follicle to see what actually happens during a treatment. AIDS and hepatitis B have become international problems and are of great concern to your clients. To reduce the risk of infection, be sure to use sterile, disposable needles. Clients prefer to see you use a pre-sterilized disposable needle. It helps guarantee their safety. By using needles only once, you avoid cleaning and sterilizing contaminated probes. Please remember that a single accident could prove catastrophic for both you and your client. Use sterile disposable needles and advertise that fact. Today, clients expect it. Electrology has changed dramatically since it was invented by Dr. Charles Michel over 100 years ago. The first electrolysis needles were modified sewing needles. Later, special one-piece needles were manufactured. Each needle was ground and polished by hand. The first two-piece needles were easier to manufacture and less expensive than one-piece needles. Wire was cut to length and attached to a shank. But breakage was a problem, and sometimes the shafts pulled out of the shanks. The tapered needle was developed in the 1940s by Hinkle and St. Pierre. This one-piece design corrected problems with the two-piece needles of their time. In the 1950s, the use of stainless steel improved the durability of electrolysis needles. Yet when Ballet started looking into the needs of electrologists in 1987, we found that most practitioners were still dissatisfied with their needles. Electrologists complained that two-piece needles were excessively flexible, subject to breakage, and often difficult to insert. And electrologists complained that Hinkle-style needles were too sharp and that no two needles were alike. Heightened awareness about the risk of diseases like AIDS and hepatitis B convinced Ballet that sterile disposable needles were vital to the future of electrolysis. We concluded that electrologists wanted a flexible one-piece probe with a smoothly rounded, polished tip. The needles would need to be pre-sterilized and inexpensive enough for one-time only use. Computer-aided design and high-technology manufacturing techniques were used to perfect the Ballet needle. Because clients have differing sensitivities and tolerance levels to electrolysis, Ballet developed a range of electrolysis needles. The Ballet stainless steel needle is the most economical choice in the Ballet range. It is sculpted from the finest surgical quality Swedish stainless steel. For clients with sensitive skin, try Ballet Gold, the hypoallergenic choice, plated with nickel-free 24-karat gold. Other clients are very sensitive to the discomfort of electrolysis. Ballet Insulated protects the sensitive surface layers of their skin, which makes treatment more comfortable and reduces the possibility of scabbing and post-treatment hyperpigmentation. Ballet stainless steel, Ballet gold, and Ballet insulated needles share a vital characteristic. The tips are micro-polished to a mirror-smooth finish, so your clients receive a comfortable, precise, effective treatment every time you use Ballet needles.
I'm Larry Coons, Executive Director of the Rocky Mountain College of Electrology, and a practicing electrologist as well. Nowadays, disposable needles really are a must. Compared to everything else I've tried in the past 10 years of my practice, I've found that the Ballet disposable needle is superior in quality.
Larry will be performing a Ballet Gold treatment. We recently completed a study at schools in North America. Electrologists told us that insertions were smoother with Ballet Gold and that their clients reported less swelling and redness. If you're using any of the Ballet needles for the first time, please take care to choose the correct current level for your clients. Many professionals find that they can use lower current settings with Ballet, so be sure to test the needles before treating your clients. Let's see what happens after Larry inserts the probe. You're looking at a human hair follicle under a microscope. As the probe slides down the hair sheath, notice how the follicle bends and moves around the needle. This cutaway view shows the needle as it comes to a rest against the base of the follicle, the dermal papilla. This scientific demonstration, using egg albumin, illustrates the point effect produced by short wave treatments. In an excellent treatment, the discharge destroys the papilla, upper bulb, and matrix. To understand the advantage of a Ballet needle, watch what happens when you probe with a needle that has a sharply pointed tip. Look how easy it is to pierce the follicle wall. With the rounded tip of a Ballet needle, the follicle stretches and bends even when you apply pressure. That's why the polished tip of the Ballet needle is so important. To understand the advantages of Ballet insulated needles, watch what happens when the intensity level is set too high with a standard needle. With high frequency current, heat moves up the needle, increasing the chance that surface damage will occur. Now compare what happens when you use an insulated needle. The discharge is confined to a smaller area, and the risk of surface damage is lower. Ballet needles are available in different sizes for the finest vellus hair or the thickest hair in a man's beard. You should select a needle size that's closest to the thickness of the hair you plan to treat. Hair varies widely from person to person. Please take this into account as you use these guidelines to choose the right size. Use Ballet size 2 needles for fine, shallow hairs on the upper lip, eyebrows, and fingers and toes. Ballet 3s or 4s are suitable for the medium hairs on a woman's sideburns, chin, chest, forearms, and on the legs below the knees. Ballet 5s or 6s are for deep or coarse hairs on the underarms, stomach, thighs, in the bikini area, and for a man's beard and back. Remember, with high frequency, the thinner the needle, the hotter the treatment. Please adjust your epilator when you change the size of the probe. Ballet needles come in 3 shank sizes to fit all types of modern epilators. Ballet is available in the standard profile and also as a Hinkle-style tapered needle. Your Ballet distributor can explain which needle is right for your epilator. Ballet needles are manufactured from the finest surgical quality Swedish stainless steel. Every aspect of a ballet needle, from the shape of its point to the taper of its shaft, is based on extensive research and testing. Each needle is inspected several times to ensure that it meets critical standards for shape and polish. Ballet's delicately tapered shaft gives you flexibility, sensitivity, and control. The gently rounded point prevents accidental puncture of the follicle wall. Ballet needles are micro-polished to a mirror finish. Our research shows that the shape and polish of the point are the most important factors in obtaining smooth insertions and precise epilation. Look at a ballet needle under a microscope. Increase the magnification. The needle still appears perfectly smooth. Even under the highest magnification, ballet needles are virtually perfect. After passing rigorous quality inspection, ballet needles are thoroughly cleaned and then packed into hospital-quality blister packs. Ballet needles are packaged and sterilized in the same manner as the disposable syringes your doctor uses. Ethylene oxide gas sterilization guarantees that every ballet needle is sterile. One-time use of ballet probes helps protect you and your patients against disease transmission by electrolysis needles. Ballet is committed to advancing the science of electrology and to developing superior products for professional use. Today, you'll find electrologists using ballet needles in over 30 countries around the world. Ballet sterile disposable electrolysis needles give you the tools you need to perform at your best. Ballet has the superior design of a one-piece probe. Every ballet needle has a smoothly polished tip of unsurpassed quality. And only Ballet gives you the flexibility to choose from among stainless steel, gold, and insulated, sterile disposable electrolysis needles. Ballet. Superior design, unsurpassed quality.